Can Australia's Labor's nurses plan work with migration? Two main Labor policies will necessitate a significant rise in the number of nurses and doctors, but many people are wondering where the additional doctors and nurses would come from. For detailed information, watch this video till the end, and yes, like and share the video, and don't forget to subscribe to our channel. Warm welcome from Brain Drain Consultants to our immigration information and news channel, A2Z Immigration Updates. The first policy relates to aged care. Labor proposes that every aged care centre be staffed by at least one registered nurse, 24/7. The second is the establishment of 50 new urgent care bulk billing clinics. These policies will require a substantial increase in the nurse and doctor workforce. In the short to medium term, much of this increase will need to be imported. Over the past 30 years, Australia has become increasingly reliant on both overseas trained nurses and doctors, as well as overseas students trained in Australian medical training facilities who go on to join the medical workforce. In this chart, there is a mix of visa categories under which registered nurses have been granted primary visas in the skill stream and the skilled temporary entry category. These would not include registered nurses on working holiday maker visas, temporary graduate visas, or nurses migrating on partner visas or working on student visas. Charts show that in 2011-12 and 2012-13, the vast bulk of registered nurses migrating to Australia were either on employer-sponsored skilled temporary entry visas or employer-sponsored permanent visas. This changed significantly from 2013-14 to 2016-17, when registered nurses made much greater use of skilled independent visas and the use of employer-sponsored visas started to decline. From 2018-19, the composition shifted again to rely mainly on state and territory government-nominated visas as the number of places in the skilled independent category were reduced, and the changes that former Immigration Minister Peter Dutton made to employer-sponsored migration in 2017-18 contributed to a further reduction in employer-sponsored migration. Australia's registered nurse workforce has been growing much faster than the rate of general population growth, partly reflecting the aging population and the difficulties in retaining nurses given low wage levels and difficult working conditions. While the overall registered nurse and midwife workforce grew at an average of around 7,000 per annum from 2012 to 2017, this accelerated significantly from 2018 to 2021, when the registered nurse and midwife workforce grew at an average of 18,000 per annum as the health system sought to attract back registered nurses who had left the profession, particularly during the pandemic. Over the last decade, the registered nurse workforce has grown by over 107,000. At the same time, over 50,000 registered nurses have migrated to Australia. It is inevitable that growing the nurse workforce further will continue to require a significant contribution from migrant nurses. Chart 3 shows the number of doctors, specialists and dentists granted skilled temporary entry visas. This too declined markedly from 2013-14 and was likely replaced initially by greater use of skilled independent visas and then state-territory nominated visas. The key takeaway from this should be that to attract the nurses and doctors they will need, Australia must fix the design of employer-sponsored visas to make them easier, faster and cheaper to use. Australia must also increase penalties for employers who misuse these visas and increase the minimum salary paid to migrants who are sponsored by employers. We hope you appreciate our efforts to provide important and accurate immigration information. Please share your feedback and suggestions in the comments section. Please like, share, and subscribe to our channel to show your support, and yes, don't forget to press the bell icon. Thank you for your valuable time, and we hope to see you again soon with another video. If you need any further assistance or want to discuss anything related to your immigration dreams, then you can book an expert consultation session with our team of registered migration consultants.